Hi, good afternoon, everyone. Thank you for joining us at ALS Canada. We are so excited to have Nicole with us today to talk about living with ALS and your dietary needs. We're going to do some housekeeping before we start. So if you have a question during this session, please go ahead and put your information in the chat box and we will make sure we ask Nicole. So there's two options we will be working with. If the question is relevant to the topic she's discussing at that point, we'll try to ask the question then. If not, we'll save questions for the end and make sure that everybody has an opportunity. The other thing is, if you have a question and you're very specific and you'd like to follow up with Nicole after, you can reach out to us at ALS Canada and we'll happily work with Nicole to get your questions answered. So thank you so much for joining us. The other thing is this session will be recorded, so everyone will have an opportunity to review it after. So Nicole, I could give a big spiel, but I gave everybody a bit of blurb. So I'd really like it if you would just go ahead and talk about yourself and share your information and we'll get started.
Hi, everyone out there across the province on this beautiful sunny March day. I am Nicole. I'm a registered dietitian. I've been a dietitian for almost 25 years, which is a really long time. And I worked with ALS patients for about 13 years at the clinic at Sunnybrook. And I'm here today to provide you all with information about nutrition and ALS. I have someone controlling my slides, so I'm not controlling them. So you're just going to just, when I say switch slides, change the slides for me. I know there's going to be a lot of questions, and I really have kept this pretty simple and straightforward. And I want to do as much dialogue as we can so I can answer all of your questions that are out there about anything you guys might have about nutrition and ALS. And that's really what the goal of this session is, to provide you all with as much information as you can and make this journey in your nutrition journey through ALS as positive as it can be as you move through the steps of your ALS journey. First slide, please. So what is your role as the patient? You have the illness. It is you and your family who is dealing with the illness. And you have a job in this illness. And your job is to try to eat as much as you possibly can and to control your weight as much as you possibly can. Some of these things are out of your control, and we as the dietitians working with you who are on this ALS journey with you, understand that you cannot always do this, but when you can do it, it is most important to try to eat as much as you can and try to maintain your weight as best as you can. Next slide. So what is my role, or any dietitian's role, when dealing with ALS, whether it be the dietitian that you're working with at your clinic, whether it be the dietitian you work with in home care? What is our role as the dietitians? We are here to manage the nutrition issues as they come up and manage the progression of your nutritional symptoms and provide you with ongoing support. So as things change, as different things come up, as different nutrition issues arise through your ALS journey, through your family and yours ALS journey, the dietitian is there to support you every step of the way to make sure you're trying to optimize your nutrition and your eating as well as you possibly can during your ALS journey. Next slide. So what do? We do not work alone. I do not work in a little square. Dietitians have to work with the other team members around you who are dealing with your disease process. So dietitians will liaise with the speech language pathologist on any swallowing issues that may be coming up. We'll liaise with all the healthcare professionals on the team, whether it be your nurse, your person at the ALS Society, ALS Canada, your home care team, your doctors, everyone on your team we are liaising with to make sure your nutritional care is best it can be during this journey. As well, For some people, we provide education and start the process of seeing if alternative feeding is something that you want to go to. We'll talk about that in a minute. And we provide education and start the process to get that happened. We provide education in terms of supplements that you may need, what kind of vitamins you might need to be taking, guide you through the process, how to access these supplements if you can have it covered by either the government paying for it or if you have private insurance. We are there to help you through this process. And really, the dietitian role and all the members of your team through your ALS journey is to provide you, the patient, and your family with the support that you need, because we need to be there for you and provide you with what you need during this journey. Next slide, please. So this is one of the really important things that is really important that you need to remember in terms of the nutrition and the dietary care as you during this process. Every person with ALS is different and will have nutrition issues and concerns that come up. I can't tell you that everybody's going to lose weight and everybody's going to have a problem swallowing and everyone's going to have a difficulty and require a feeding tube. Everybody is different and needs a different path or journey for themselves. And as your disease progresses, the nutrition issues you face will change. And as they change, the dietitian or anyone working with you will have to help you make the changes to make your nutrition as most beneficial for you as possible. And your dietitian is there for you every step of the way, whether it be a dietitian you work with in the community, in privately, at a clinic. We're all there to help you and work together to make sure that as you go through this journey, we are there for you through the whole process. Next slide. So in terms of a diet or what you should be eating or what a person with ALS needs to be eating, I wish I had a different answer for this, but really there is no ALS diet. Everybody with ALS should really be following a healthy, well-balanced diet with a variety of nutrient-dense foods from all the food groups. So you should be having your fruits and your vegetables and your grains and your protein-rich foods like milk and cheese and eggs and nuts. You should be really having all those things. And enjoying the foods that you like is probably the most important thing as well, and making sure you have some healthy stuff on the side. Eating a nutrient-dense rich diet will help slow down muscle atrophy, strengthen immunity, and fight infection. So it's important to have all the good stuff, but also it's really important to increase overall calories with a focus on high-fat foods, which will provide more energy and help maintain the body's muscle fat. So yes, you can be getting all these high-fat foods from the good fats, like olive oil and avocado and fatty fish and nuts and things like that. But by all means, if you want to have a big bowl of ice cream or have bacon or have things that have full fat, by all means, you have the golden ticket to really eat whatever you can safely. So if you want to eat protein and all those kinds of things, it is okay, because the body needs that and your body should be able to have those things. And that is really important for you to make sure you're getting as much calories as you possibly can. Next slide. So in terms of the nutrition issues that are occurring when a person has ALS, there's really 6 main issues that occur, and I'm going to talk about those 6 issues that occur in a person today, and in pretty simple terms, not in any medical complex terms at all. And then I'm going to go through some key things that you can be doing to help with all of those things. So the main things that as a dietitian, or the nutrition issues that are occurring, are things like dysphagia, which are swallowing problems, dehydration, which is lack of fluids, saliva issues, where there's extra saliva or not enough saliva, which is making me want to have a drink because I don't have enough saliva right now. GI issues, which are gastrointestinal issues like constipation, runny stools, bloating, things like that. Respiratory functions, which are really important, things that are going on with the breathing functions in your body, and weight loss, which is a big problem that occurs in many, if not all, ALS patients. Next slide. So dysphagia, swallowing problems. Some people, one of the first symptoms they have is changes in the ability for them to swallow or chew food, which often is called bulbar ALS because it's occurring in the mouth of the body. And why are these things occurring? As we know, ALS is a muscle weakness. So there's definitely muscle weaknesses that are occurring in the mouth, and which causes food and liquid to spill from the mouth, which causes the changes in the person's ability to swallow and chew their food, which can lead to airway penetration or aspiration pneumonia. And as these changes are occurring, you may require a change in the type of foods you're eating to make them softer, more pureed, easier to swallow, easier to chew. So those kinds of changes may occur. You may have to have thicker liquids so it's easier to swallow the liquids. We don't quite think about it, but the amount of muscle and brain focus that needs to occur when you eat a meal is quite huge, and eating and swallowing are quite difficult things to occur in the body, and it's one of the very initial things that happens in many people with ALS, which affects not only their ability to swallow and eat, but also their ability to speak, and they're all occurring at the same time. So the dietitian will work with you to make sure you have that best textured and safest textured food if these changes will occur. And you always should be working with a speech language pathologist if you're having any swallowing issues. And then the speech language pathologist and the dietitian will liaise together to make sure you're having the safest foods possible in terms of your swallowing issues. Next slide. So dehydration, which is basically when your body is not getting enough fluids and you don't have enough fluids in order for your body to be doing all the things that it needs to be doing. And why is this occurring? Well, it's occurring because of the dysphagia. It's harder to swallow thin fluids. And the other thing that is occurring is oftentimes as you lose your ability and have much less function in your hands, the ability to just go grab a drink and drink it becomes much more difficult. So you often start to drink less. The other thing is going to the bathroom can often become more difficult. So you actually don't want to be drinking, even though it's very important to be drinking. So you're not getting enough hydration in your body. It's really important to keep yourself as well hydrated as possible. And it doesn't have to just be water. Fluids come from all kinds of things. It comes from liquidy things like juice and milk and water, but it also comes from fruits and applesauce and other fluidy rich foods like milkshakes and smoothies and soup. So all of those things are really important that you get enough of them, because poor hydration can lead to many medical issues, which can spiral out of control. So it's really important to have as much fluid-rich foods as possible. Next slide, please. Your saliva. No one ever really thinks about saliva until they either have too much of it or not enough of it. And often with ALS, because there's these changing things that are occurring in the mouth and inside of the muscles and inside of the mouth that are occurring, you lose the ability to control your saliva, which can lead to excessive amounts of saliva buildup. So we tell people they need to be conscious of swallowing their saliva and remind people to swallow their saliva. For some people during the ALS journey, they lose that ability to swallow the saliva, and they develop thick saliva that just spools out of the body, and it becomes quite uncomfortable. It can lead to all kinds of different issues going on. Now, to control that saliva, there's different things that can happen. We can use a suction machine to help suction out the saliva. There are different medications such as atropine and Elavil that can help to control saliva. There are Botox injections, not to make your face look prettier, but they actually inject into the salivary glands to help control the saliva, which is done at different hospitals by specialists. I know they do it in Toronto. So all of those things are medical things that can happen. In addition, we know that some people, their saliva becomes so thick that it often feels like there's like this drawing sensation. So we want to say that we want to avoid certain diuretics like caffeine and alcohol, because it can actually make the saliva even worse. And we want to make sure we're actually as well hydrated as possible, which kind of seems ironic because we're trying to not have all this thick saliva in our mouths. But if you have more fluids, your actually saliva production becomes more controlled. So it's really important to make sure you're as hydrated as possible to make sure you have better saliva control. The other thing, there are some antidotal things that say that people have tried things like lemon and lime and different types of papaya and food softeners to help control the saliva. Those are all antidotal. Some of them can work, some of them can't work, but honestly, to help control the saliva, anything that you can come up with that helps, it's really important to try to do those things to help control the saliva. Next slide. So GI issues or gastrointestinal issues. You could do an entire lecture on different gastrointestinal issues that are occurring. Constipation is very, very common. Constipation is when you're not having a bowel movement every other day or every 2 days. Why is this constipation happening? Well, first of all, when a person moves around, their bowels move, and often you're not moving as well, so that leads to constipation. The other thing is, we know with ALS, there's slower bowel motility. Things are just they're slowing down. The muscles in the stomach are slowing down, just like the muscles in other parts of the body are slowing down. Our abdominal muscles, which lead to the breathing issues, are also being weakened. So we're not moving as well. And also, many people do not have enough fluid consumption. So all of those things lead to constipation issues. And so what do you do about the constipation? Well, if you cannot get enough fluid in your diet, the next thing is to add more fiber into your diet. Things like whole grains, fruits, vegetables, cereals like bran, dried fruit, all of those things can help. Sometimes the fluid and the fiber are not enough and you need to go to medication. My first line of defense and my favorite product is something called PEG 3350, which is sold as Restoralax or Laxaday or whatever name brand you can find. It's a powder. You have it every day or every other day. You can take it for every day for 365 days a year for multiple years, and nothing will ever happen to you. So if the fiber and the fluids aren't working, I would try the PEG first. For some people, you start the PEG and that still doesn't work. You may need to have a medication like a Docasset or something like that. Once the food, the fiber, the Docasset, and the PEG are not working, then you need to seek medical advice, and you need to have an actual medication with a script, and there's multiple medications that can be used that the doctor can prescribe to help with the constipation. Being constipated is really bad, and it causes a lot of other things to be occurring. So if you can get that constipation under control, it can help in the big picture of so many other things. So really try to get that constipation controlled. Moving on, bloating and gas, which are and burping, also are common in ALS patients, often related to how you're sitting, the changes in your body in terms of your abdominal muscles. Mostly bloating and gas can be helped with stopping certain foods that become a problem with it. Sometimes taking a probiotic can help with the bloating and gas. So all of those things should be dealt with. Another thing is reflux, usually cause like that burping sensation or acidity coming up. That can also occur. So that can be helped with changing your diet, having less acidy foods, chocolatey foods, alcohol, spicy foods, all can help with the reflux. You also might need to take a medication to help with the reflux. Diarrhea is not a huge problem in most ALS patients unless it's caused by starting a new medication or something like that. Diarrhea usually happening when a person is on a feeding tube. That's when diarrhea issues usually suffice. Other diarrhea issues are usually caused by medication or an illness, and different things can help with diarrhea, and like starting a probiotic, making sure you're not eating certain foods, and just watching the things you're eating can help with the diarrhea. So that's basically the GI issues. But just so you know, a GI issue in ALS can exacerbate and cause so many other things to make you not feel well that you should truly try and work with your team, because a GI issue is really a team approach to get the GI issues dealt with. Next slide.
Nicole, we actually have a question on that, and someone is asking, can you reiterate where they have access to the PEG 3350?
So PEG 3350 is sold in Walmart, Shoppers, online, if you're not shopping right now, as Restoralax or Laxaday. Those are the big names. Different companies also have no name brands of it, but that's where you can really find it. It's a pink container. That's how it's sold as. I believe Shoppers has their own brand of it. Clear Sac, I'm not sure if that's what it's called, but that's what the names it's sold under. You can buy a big container of it at Costco.
Okay, the second question we have on this one is, thank you for the great presentation. For fluid intake, are straws easier or harder for ALS patients?
So that's a good question. And actually, for some people, because of the ability to swallow and with the air and the swallowing issues, some people can't manage a straw, and it's actually more dangerous to be using a straw. But for some people, it's okay to be using a straw, and it's really dependent on your abilities to swallow. And for some people, when you think about swallowing, if you use a straw, this fluid goes down much quicker than if you drink it from a glass. So if there's any swallowing issues going on, it's really important that you are aware and maybe be careful with that straw. But in terms of accessing fluids, it's much easier because you can actually have your cup on the table and lean down and actually just reach for the straw, and you don't have to use your hands. So it's easier in that respect, but you have to make sure it's safe in terms of your swallowing. So that's the thing about the straws.
Cool. So there's a question from the previous slide in terms of how Botox works. Is it effective, and how long does it work for?
Okay, so in terms of the Botox, every single person is different. I am not a doctor that I can speak to this. I just know anecdotally from patients with that I've worked with a wide range of different neurological disorders, not just ALS, in my history of being a dietitian. It's very dependent. Everybody's different. They inject it along your face in that little area where your salivary gland is, and they do it a couple times. It works, but I have a patient right now who had a brain injury as a result of a car accident, and he did it, and it didn't work for him. but it's worth trying. But for everybody, it's different, and they have to sometimes do a couple of them to see if it actually is going to work. So it's worth a try, but it doesn't work for everybody.
Nicole. Okay, we're going to go to the next slide, and then if you have questions, continue to keep asking them, and we'll just stop as we go.
Great questions, everybody. Keep up asking the questions. So respiratory issues. Breathing issues and ALS are a huge thing that go hand in hand together. And it's really important to understand how, as your breathing changes and your respiratory function changes, it also affects how you're able to eat and the amount of food you're going to eat. Most people who are coming to the different ALS clinics, depending on what's going on in terms of COVID and different kinds of things, will have a pulmonary function test to determine their breathing function. I'm not sure if that's happening all the time now, but you get a value to determine how you're breathing. And some people, depending on how they're breathing, will get put on a BiPAP that will help the breathing process. Why does breathing affect eating? Because eating, you're breathing while you're eating, and you can become exhausted and short of breath while you're eating, and it can become even more laborsome to complete a meal. I always say, if you have on BiPAP, to give yourself a boost before you're going to eat your meal, get on your BiPAP before so you can have a little bit more energy to eat. So it can make you feel a little bit better to help eat better. We have seen patients in the past, I've seen patients in the past who have been on who've started on BiPAP, who've actually been able to gain a little bit of weight when they started on the BiPAP because they were able to eat a little bit better once they started on the BiPAP. So respiratory issues really work side and side with nutrition, and often as a person starts to have more respiratory issues, the nutritional issues also start to become much more apparent. They go side by side. As respiratory function starts to decline, so does the weight loss, and different nutrition and swallow issues occur as well. So they all kind of go together. Next slide.
Nicole, we have two other questions. One is medical Botox covered by Ohip?
I believe it is covered. Yes, this is not Botox to get rid of your wrinkles. It is medical Botox. I'm pretty sure it's covered, but don't hold me to that. I know in Toronto there is a clinic at West Park that does Botox for saliva that they do there. Yes. There was another question you said?
And the second question is around GI issues. The question is, my wife often has false alarms when she thinks she needs to use the bathroom. Is there a solution to this problem because it consumes so much energy?
Right. So two things. One is establishing a pretty good bowel routine where first thing in the morning you actually sit on the toilet for a little bit of time to try to get whatever is inside to come out of the body, so you don't have false alarms during the day. The other thing is that it could be that because she has false alarms, could be that she's actually constipated a little bit, and if she starts to take the PEG, sometimes it can help make things be more regular, so you're not having to run to the washroom all the time. When you actually go to the bathroom, everything is coming out, so you don't have those false alarms during the day. Because yes, going to the washroom is an exhausting process of having to get to the toilet, and we try to minimize that as much as possible because it's energy that could be used for other things. So going on the toilet for maybe a little bit of time in the morning or in the afternoon and then in the evening can help alleviate that. Oh no, do you see this on your side that just came up on my computer? Do you see something weird on the screen?
Nope.
Okay, good. Okay, it's just on my computer. Perfect.
I'm going to go to the next slide, but keep going with your questions, everybody. Much appreciated.
Yes, please. The questions are the most important thing, because really everybody out there, your questions will answer the antidotal, the little things that I might not think of, but you are all thinking of, and I'm here to provide you with the help to answer those kinds of questions. So please, if you have any questions, please, please, please put them in the chat. So weight loss. Weight loss is a huge issue with ALS patients. One of the things that we really, the goal is with an ALS patient is to try to maintain the current body weight and prevent further weight loss, because it's really hard to gain weight that's already been lost. So one of the things we always say is it's really important to try to maintain your current weight and prevent further weight loss. Now, some people with ALS actually have a shifting of the weight in their body, and they may not look like they've lost weight, but their weight has shifted to different things. A very common feature in some people with ALS is something called an ALS belly, because weight has shifted from the muscle of the arms and the legs, and it actually is all in the stomach and almost looks like a person is pregnant, but it's just the shifting of the weight, and that is something totally normal that is occurring, and it's okay, okay? Nothing to worry about. It's just something that is occurring. You should never go on a diet to try to lose weight when you have ALS. It's not a good thing. You do not want to try to lose weight. It's something that it's really important for you to be eating as much food and nutrition as possible. So you need to make sure that you're getting the nutrients you can. The other thing that is important is to keep a record, if you can, of your weight, either once a month, just to know where things are at. If mobility becomes an issue and you don't know your weight, that's okay, but it's really, if you can keep a record of their weight, that's something that's really good to have. Next slide, please, unless there's any questions.
Nicole, one of the questions is around that weight record piece that you just spoke to. How often should people be taking their weight if they can?
If you can take ever more than once a week, never more than once a week, once every 2 weeks. If things are stable, once a month, once every 2 weeks. If there's changes occurring and you're noticing that you're not eating as much or your clothes are starting to feel differently, then weigh yourself once a week if you can and just see where things are going. We always say that if you lose 5% of your weight in a month, or between 5 and 10% of your weight in a month, that's really a red flag, and you should really be following up with someone about that if that's occurring. So we usually don't go by number, we go by a percentage of weight loss. So if you see the numbers starting to drop, you should be in touch with somebody to let them know you're having the significant weight loss. What can we do to try to stop this weight loss and do different things? So some of the things to help with weight loss, to try to get as much calories in every bite, to make sure that you're getting all those calories in, is to make sure you're well rested before your meals. So not feeling exhausted before your meals. Something like modifying the texture to make things softer. So things having more sauce on them, things making them creamier, adding gravy to them. High calorie supplements that you can either make at home, like a high calorie shake with homogenized milk and ice cream and protein powder. You can make those yourself, or you can buy them like a Boost Plus or an Ensure Plus. All of those things can really help in terms of getting extra calories in. Using the BiPAP before a meal can help with weight loss. Nutrient-dense foods such as avocado, cream, olive oil, all kinds of things that are high in fat, adding them. I often have told ALS patients, you make bacon, you see the fat from the bacon, put it in something else and eat that fat because it's all good for you. Have a tablespoon of olive oil, there's 100 calories in it. All of those things are all really nutrient-dense foods that can get the calories to come up. The other things Preparing food can also become an issue with ALS. Accessing Meals on Wheels, which is through the LIN, or if you don't want to use the Meals on Wheels, there's other prepared meal services that are out there, or you can ask friends to help you make your meals, because you don't want to be wasting your, oh, look at that typo on my wheels. That's a bad typo. I just noticed on the spelling. Sorry, everyone. Or you don't want to be wasting your energy on preparing foods if you don't have to. If you can have them prepared for you and use your energy to be eating or to be being with your friends and being social, is much better than using your energy to prepare the meals. Next slide.
So Nicole, we have a question on this one in terms of how I should eat. Is it better for me to eat smaller meals or larger meals? And should I space those out to, 3 or 6 per day?
Every single person is different. If a person can have 3 big meals and is not losing any weight and is doing just fine, that's fine. Great. If a person is exhausted after eating a little bit of a food, then they need to be having small meals throughout the day. It does not matter when you're eating, as long as you're eating or have much. Some people need to be eating every hour on the hour to get all the calories in the day. That's why I've always said every patient is different. Everyone needs different things happening to them, and they need to be individualized. It really doesn't matter, as long as you're getting all the calories in and trying to prevent the weight loss. It does not matter. Whatever works for you is fine. Okay, is there another question on that?
There is a question, and I'm not sure if you're going to address it later, so I'll ask it now, and then you can say we're going to go to it. One of the questions is, some of the formulas for PEG tubes have a lot of sugars in them, corn syrup. Is this healthy?
I'll get to that. Wait about 10 minutes and we're going to get to that, okay?
Perfect.
Any other questions you see up, or should I move on?
You can go ahead and move on. We're good.
Okay. So in terms of alternate therapies, every single vitamin, mineral, nutraceutical has been studied on their link with ALS. They've all been studied. Every single one has been looked at. And unfortunately, there has been no link between any of them in helping ALS. Future research will always continue in this area, but for now we know that there is not one certain thing that will help. Now, is it okay to take a supplement? Absolutely. Should everybody be taking a supplement? Well, everybody needs to be taking vitamin D, but you don't need to be taking mega doses of any other kinds of supplements. You really don't need to be taking them. If you think they're helping you, you do not need to be stopping them unless they are either harming you or harming your pocketbook, because some of them are quite expensive. So it is okay to continue if you think they're helping, but I cannot tell you if there's any medical evidence, and as long as they're not harming you, they're okay. That's really all I'm going to say about vitamins and minerals. I'm sure there's some questions out there. Please put them in the chat. The other thing is that there are many, many different diets that people have tried, from keto to high fat, to low sugar, to all different things you could ever imagine. There's no evidence that any of them are going to work in terms of helping your ALS. I wish I could tell you otherwise, but that's what the research shows. You can try them as long as they're not harming you. For example, some people all of a sudden will stop having sugar and stop having wheat, and they'll lose a significant amount of weight. To me, that is not a good thing, because your body needs the calories from those foods. So if you're going to all of a sudden stop all of these things, you need to make sure you're having enough calories in order to prevent weight loss from occurring. So that's really really key, that if you try any of these things, please ensure that your body is getting all the calories that it needs to prevent any weight loss from not having certain other foods. But really, If you want to have ice cream and French fries and blueberries and any kind of food, eat them because you can, and there's no evidence that says you can't. Okay, so that's really what I wanted to say about the alternate therapies. Any questions?
There is a question they come up as you go. Why is vitamin D so important?
Vitamin D, well, every single Canadian from Newfoundland to Victoria needs to be taking vitamin D, because the only way we get vitamin D is from the sunshine, which we seem to not get enough of in Canada, although today is a beautiful day. So the only place you can get vitamin D is from the sunshine, or from drinking milk, or from having a supplement. Not everybody's going to have 4 glasses of milk every single day because it's been fortified. So we need to take a vitamin D supplement. For some of you, you might remember when you were younger, you lined up in the hallways of school and they gave you the cod liver oil to have to get your vitamin D. So it's really important that you take that vitamin D, 1,000 international units every single day, and get that vitamin D. You can have it in a little pill or a drop, but it's actually the only vitamin that I recommend that everybody should be taking. Okay.
That's all the questions for that slide. Thanks, Nicole.
Okay, so alternative feeding, which is different than alternative therapies. Alternative feeding is really feeding tubes. And feeding tubes are an option for every ALS patient who chooses to have a feeding tube. It is definitely a choice that you can either choose to make or choose not to make. What does a feeding tube or feeding from a feeding tube do? It will help to maximize overall nutrition. It can help maintain weight, conserve your energy, prevent dehydration, and provide you with medication. If you're able to, you can still eat even if you have a feeding tube. You are still able to eat even if you have a feeding tube in. It is your personal choice. It is completely up to you if you want to have a feeding tube or not have a feeding tube. And it's really a good conversation to have sooner rather than later. It should not be made as an emergency decision. It's something you should always be talking about and thinking about, because when it comes up, you should have thought about it before the decision has to be made. So it's really important that you and your family talk about if it's something that you want to have, and if you want to have it, a plan to be put into place to have it. Next slide. So everyone asks, well, why should I have it? Is there evidence about it? What is it going to do? So there is evidence that suggests that a feeding tube or feeds will help to stabilize body weight. So yes, most people, but not everybody who has a feeding tube, the weight loss will stop. However, it's not going to guarantee that you're going to gain weight, but for most people, it stops weight loss and it gives your body the nutrients that it needs. Evidence suggests that a feeding tube will prolong survival in a patient with ALS, but we don't know for how long or any of that kind of stuff. There is no evidence that supports an increase in quality of life from having a feeding tube. And we don't have specific evidence on when to put a feeding tube in. However, we know that the risk of having a feeding tube put in increases when your breathing capacity declines below 50% via PFT. If you think you want to have a feeding tube, it is always better to do it sooner rather than later. I know with all the changes in the medical system right now with COVID and things going on, sometimes you're making that decision and you can't do it as quick as possible. But if it's something you want to do, you should start the process sooner rather than later, so it doesn't have to be made as an emergent decision. It's a very hard decision to make, every family member and every person will have a different thought on it, and it's your and your family's decision to make, and there is no judgment in any of the way you make that decision, and your team of healthcare professionals is there to help you and provide you with information that you need about making that decision. Next slide.
So Nicole, this is the question that we inevitably knew was probably going to come. This is coming from someone in the chat. What does the procedure involve?
So that's in my next slide. You go to the next slide. So how is a feeding tube put in? So feeding tubes are placed either by a gastroenterologist, which is a GI doctor, or an interventional radiologist. So those are the two parties or the two medical professionals that put the feeding tubes in. Sometimes it can be done as a day procedure. Sometimes it requires a hospital stay. It depends on the patient and the whole big picture. You can't just know if it's going to be a day procedure or not a day procedure. When it is done by interventional radiology, basically that you are in the suite in radiology. They make, either depending on if they put in the type of food, the type of tube they put in. Sometimes basically what they do is they make, put a tube in your nose to, that's the first step. They put a tube in your nose to clear the air in your air cavity. And basically all they need to do, I'm going to just stand up, is they make a little incision in, you can't see this, right about here, and they put in that tube, and you have this little tube with a little cap on it where you get your feed will go through. That is the simplest and easiest way that it's done. And then you have the tube that's in your stomach that you get fed by. Sometimes what they have to do is they have to take the tube and they guide it down your stomach through with a special camera, and then they put the tube in and they pull it out, and you have the tube there. So those are done by radiology. The procedure takes no more than 15 to 30 minutes. I've watched it being done. It's a very simple procedure. You're not usually put out depending on what is going on with your breathing function, but you're definitely get some freezing so you don't feel anything that's going on. So those are the simple radiology ways that it's done. It's also done by gastroenterology, where it's more of a complex procedure where they actually make an incision on the side of your stomach, and they put in that tube that's used to feed it, to provide the feeding. So the procedure does not take a long time to do, but it must be done in a hospital by professionals, and that's why it's often complicated to get the procedure done, but that's really how it's done once it's done. And then you have this tube where you can be fed by. And so I think that answered how it's done. And then you're fed through this tube. You can still eat for some people, but you're then being fed. So there's different ways that you can be fed from a feeding tube. One of the ways is basically by using a syringe. Everyone knows what a syringe is. It's a big syringe that you basically just put through to the tube, and you get your nutrition through this syringe feed. That happens. That's one way of eating, getting the nutrients that you would use. Another thing is, you all know what an IV is, and an IV has nutrients in it. Well, instead, you put the nutrients of the feeding tube in a bag, and you just kind of hang it over a door or somewhere like that, and by gravity, the feed kind of just drops through the tube and goes into the stomach. So that's another simple way. The more complicated and the item that needs the most stuff is a pump feed, whereby a person has an actual fancy pump that with a rate and the water and the feed are all working together to get the food through the body, from the pump into the body. So those are the ways that the feeds get in and how the feeding tube is done. So that answered that initial question about how a feeding tube is put in. Next, any other questions? I'm sure there might be some from that.
You are right, Nicole. There is some more questions. If someone can't lie flat without the BiPAP, how is the procedure done? Can it be done in a sitting position? The first one.
And so every hospital will make a decision about that. So some hospitals can, some hospitals can't, and that is a very specific question that will be patient specific, that is done when a referral is made for the procedure to be done. And it will be dependent on the doctor who is doing the procedure to decide about if they're willing to do it or not.
So the next question is, how often do you feed with the tube?
So everybody is different, depending on, like, I'm going to need a different amount of calories in a 6'2" person who's 100 pounds more than me. Everybody's going to need a different amount of calories. Usually with the syringe feed, a person can at the most manage about 400 to 400 calories through a syringe. So usually they need to be fed 3 to 4 times a day, almost like breakfast, lunch, dinner, and a snack. Some people, so that's how the syringe feed will work. Some people who are on a gravity feed will have the feeds run a couple of hours, like depending on how fast they can tolerate it, will run 6 to 8 hours a day, twice a day. Some people who are on a pump, they can have the feed run continuously. Everybody is different depending on the calories they need and the amount that they can tolerate at a time, because for some people, they can't have it flow through their bodies very, very fast. So it has to be slow. Some people can't tolerate a syringe feed and they need to have a gravity feed. It just depends. Everybody is different. And you will always have a dietitian from usually the Lynn who's at home with you, monitoring all of this stuff with you to make sure you're getting your maximum calories in the shortest amount of time in the safest way possible. So you are not doing this alone. There's always someone there to guide you to make sure that this is happening safely and effectively.
So, Nicole, one of the questions is, what do you mean by when you say the word tolerate? Is it the feeling, the amount before you have to go to the washroom, feeling full? What does tolerate mean?
So tolerate is that you're not. So tolerate is basically you don't feel like the feed is gonna come up, like you're gonna throw it out. You're gonna have to go to the bathroom excessively. It's that feeling that you would actually get just from having dinner, basically. It's just that normal feeling. All of a sudden, if you're feeling really, really full, or you're feeling like the feed's gonna come up from your mouth, those are all things that need to be worked with specifically with a dietitian to make sure you're on the proper feed and it's not going too fast, and you're getting it by the best method.
So Nicole, one of the questions is, am I getting enough calories? How do I know I'm getting enough calories with the feeding tube?
So your dietitian figures that out for you, basically. So it's basically, a dietitian will figure out how many calories your body needs, and then from figuring out how many calories your body needs will determine what's the best product and how much of that product, because some products have 1 calorie per mil, some have 1.2, some have 1.5, some have 2. So every single person is going to be different in terms of what and how much goes through the tube, depending on how much they need. Now, in terms of the products for what goes through the tube, most ALS patients should always be started on Peptamen 1.5, which is a really good enteral product. It's high in calories. It's easier for the stomach to digest and absorb. So that would be the first line of defense for most ALS patients, to be started on a peptamen 1.5. If a person doesn't tolerate it, there's other products to try. Going back to the question about the corn syrup, it's a huge issue. And I respect that it's a problem because people see that corn syrup. If you can make your Ensure and your Boost by yourself, you can do that. But Nestle, for example, has a product that's called Organic Blends, which is actually made from food, and doesn't have those items as the first line of defense, the first product listed. They're really good products. Unfortunately, they're not covered by ODB, the organic blends, so you actually have to pay for them, which can become quite expensive. But they're a really good product. So that's something to think about. There's also, which is even more expensive, a product called Liquid Hope that is another product that is made with just real food that can also be put through the tube, and something for you to consider if you want. But most people do great on peptamen 1.5. And if they don't do great, the dietitian works with you to find the product that works best for you.
So one of the next questions, Nicole, is once the procedure is done, can it be removed? For example, if it's not working?
100% it can be removed, for sure. It can be removed. If it breaks, it can be changed. All of those things it for sure can be removed. Yes.
Great, thank you. We'll go to the next slide.
There's no more next slides. That's the end. But I'm here, and I'm here to answer any questions anybody may have that I have not answered. So if anyone has any other questions, please feel free to put them in the chat, and we can answer those questions for you.
So Nicole, one of the questions that is being asked is about the choking on the water situation, and what people have heard about the thicket and those things. Can you talk a little bit about that?
Yes. So when you drink water, you never really think about it, but it involves multiple muscles in your mouth. And actually having thin fluids is one of the hardest things to control, to get down to your throat without choking, because it can easily, in your throat, there's two flaps. And if the flap doesn't close to go down properly, the thin fluid can just escape down into your airway and cause you to aspirate and develop pneumonia. So to prevent that, some people have thicker fluids because they're easier to control. So you can do things by just bypassing the water completely and having things like applesauce or like the series thicker juices, so that those things can happen. The other thing that you can use are these products that thicken the fluids, like Thicket or Resource Thicken Up, or you can even buy thick fluids to use. So those are all things. Now, for some people that works, some people that doesn't work. For some people, you can try to have water without anything else going on, but that's something you really need to talk to your speech language pathologist about, because you really have to see the risk benefit ratio of what's going on, and that's very individualized that you need to work with your care team to figure out what's the path you as a person want to go on. But anything is possible. You just have to be aware of risk benefit in terms of what is going on.
Okay, we're having a lot of questions come in, Nicole. So the next one is any non-vanilla supplements that you can recommend. The vanilla flavor is pretty awful.
So there's chocolate. There's lots of chocolate. There's strawberry. You can flavor anything up with a blender. You can blend up any kind of fruit that you could ever imagine and make something. You can make things chocolatey. You can add mint to things. There's recipes that you can add all kinds of things to make the flavor taste better. But yes, some of the flavors are just not great. And I believe Ensure and Boost, not Plus, come in things like butter pecan and all kinds of different flavors. There's definitely been some supply issues over the last year with getting some of the products, but they do exist. So keep checking at Shoppers, Walmart, and your local grocery store. And but Amazon their supply on Amazon has been horrible lately to get some of those products. And I personally don't know what's going on, why that's happening, but it's definitely an issue.
Thanks, Nicole. So the next question is, my dad complains a lot about feeling the need to choke up thick saliva, mucus, etc. He finds it very unpleasant and draining. Any suggestions for him?
So there's, you can use the suction machine to help get it out. Sometimes the cough assist can help because it can help assist you cough up the thick saliva. Sometimes you need some extra fluids to break it down. Some people try some cough syrup to break it down, like a Benylin. All of those things can help. Saliva issues in ALS patients, in all patients, they suck. And it's really hard to find ways to control it, but we all do the best we can, and just trying different things and seeing what best works. I think you said your dad, for him, just try them all and try to find something that works. But I know it's really hard and it's draining to have that saliva pouring or being stuck. I would talk to your team to see if they can come up with some ideas to help with that. Because there are things that can help, and it's just finding the right thing that works.
So this next question is from a gentleman, and he's asking about his wife. My wife has tried a lemon-based drink and has had good success with it in terms of not coughing as much. However, sometimes she coughs and struggles for air. What options do I have as a husband to support her?
So you can thicken it. That's one thing you can do. You can discuss the situation with your speech language pathologist to see if they have any issues. You can make sure you know what to do if she's choking, like the Heimlich maneuver and different things like that. And you also need to have a discussion in terms of quality of life, where you want to go with this. Do you want to continue having that even though it's causing you problems, or do you want to stop it? They're really important questions and conversations that you need to have to see where things are going and what you want, how you want things to proceed.
This gentleman is asking a question. He's lost 20 pounds and he has a feeding tube. Should I try to gain weight or just maintain?
It depends. That's a very specific question, and it just depends on what your weight was before, where your weight, where your BMI is. Try to stop, lose more weight, but I can't answer that question without more specifics.
Is decaf coffee an okay solution? In terms of alcohol, are there some that are better to consume than others in terms of the saliva issue you mentioned?
Trial and error. Everybody has a different issue when it comes to different foods with saliva. Everybody's different. If you want to have a drink, if that's causing you saliva, I would stop. But if you want to have a drink, even though, because you want to see what it's like, it's trial and error, and everybody's different.
Can you recommend a cookbook for making healthy high-calorie supplements for feeding tubes at home?
There's not so much a cookbook, but you can Google like high-calorie recipes. A lot of the cancer websites will have high-calorie websites in terms of supplements. But honestly, if you just take an ice cream, and when I say ice cream, I don't mean regular ice cream. When you look at the ice cream container, make sure the first ingredient on the ice cream is cream. So a high-level ice cream, like a Haagen-Dazs or a good Breyers or a good Kawartha Diaries. Use that as your base because there's a lot of calories there. Then you add in some homogenized milk, the red milk, which has lots of high calories. If you want, you can leave it at that. That's enough. You can also add in some frozen fruit to give it a fruity flavor. You can also add in any kind of protein powder or even skim milk powder. And there you have it. Or you can even add peanut butter into it. So all of those things will make a really good smoothie. Or you can, so those are the kinds of, that's how I would make it. Or making a cream soup and using, when you make a soup, instead of using skim milk, use cream, or even putting cream into the actual smoothie that you're making. It's really finding the most calories. You really are aiming to get the most bang for your buck for every single piece of food that goes into your body. That's really the most important thing.
Nicole, this has been the most engaged session we have had from our audience since we started doing webinars at ALS Canada. So first of all, thank you so much.
You're welcome.
If people have specific questions that they would like to ask Nicole, reach out to your regional manager and we will happily reach out to her to get in touch. People are saying thank you so much for taking the time today in the chat box as well. They really appreciated it. And so if there is something, we'll happily follow up with Nicole to make sure that you have the answers to your questions. If you don't have a dietitian and you need one, please reach out to the LIN and have that, reach out to your care coordinator and be assessed so that you can have access to that. If you're affiliated with an ALS clinic, please reach out to that clinic and they will then help you also getting a dietitian through their services. So we want to thank everybody today for taking the time. Nicole, thank you again. Thank you to everybody who came on the call today to listen. We appreciate this and we hope to see you next month at the next session.
Take care,
everyone.
everybody.